We are diligent, and that's why we are ranked number 1 in education. We can clap for ourselves for that. Just we are diligent, and when we are diligent, but it says we are going to stand, and therefore we are standing among the best. And when we stand among the best, part of what we do is to have this in place. We have awareness, we have the awareness centers, we have activities of the awareness ongoing. It's part of what we are doing. That's good. And one of those things I want us to see at we are doing is to look at a place that has to do with how far have we gone and where are we? How far have we gone and where are we? I don't know what's happening. But Prof. Chair, I want to call attention to 3 components or 4 components that we need to have a good understanding of physical activities. Physical activities and exercise, they are not the same. We use it interchangeably, but they are not the same. Physical activities and exercise, they are not the same. What is physical activity? We all know physical activity is any bodily movement that has to do with muscular muscles involved, skeletal muscles involved, and energy is required. Any bodily movement that required skeletal muscles and you have energy required. Meaning the moment you are not sleeping, you are doing one physical activity or the other. Any bodily movement with skeletal muscles and energy is required, you are doing physical activities. You may not be doing exercise. But the point here is movement. And what is movement? Movement is a change in location. It's a change in location. Then when you say a change in location, you now move into what is mobility. It is your ability to change from one place to another that brings about movement. When you do the movement, the Father God that created us expect us to move. And the nature of anatomy and physiology, for those that know it very well, will want a change, a movement at the joint of the body. If you don't allow the movement at the joint of the body, then the joint will be stiff. We want to avoid that. Therefore, we now have a position where you change a location and move to another thing, allow the movement in the body. That is good. It is not exercise. What is exercise? It is expected to be, it is activity that are physical activities that are planned. It's physical activities that are structured. It's physical activities that are organized based on your specific need. At that point in time, they will say you need expert advice. Because the intensity of it need to be considered, the duration of it need to consider, then the need for it and other risk factors need to consider. WHO is not saying you must consult your experts to design physical activity for you. They said you should be active, be physically active, change your position, walk around. And when you do this, you come into the concept of awareness. You are better off. You are better off. And when you get your awareness, then you have the effect of physical activity that you do to be healthy for academic performance. You have it for muscular fitness. You have it for cardiometabolic health. You have it for brain health. You also have it for long and heart function, long-term health and healthy. For children, you also have it not only, you have it for the immediate and the long term. For adults, you have it for those with chronic diseases, and you also that is helpful to them. You also have it for those people that want to have a multiplication to fulfill what Jesus Christ, what God asks us to do. Have more of them. Then you need exercise. By the time you do this, then you have the benefit across board. Ladies and gentlemen, where are we? This picture image is from WHO, indicating our physical activity level over the world. The blue color are those ones that are physically active and dominating because of their engagement. And if you look at those, we can easily see it where our country is. We can easily see the color we have. Am I doing enough? For us to know, identify, these are components you look at for you to identify your physical activity, what you are doing, if you are doing enough. These are the indicators. You look at your sports and physical activity. What are those sporting activities are we organizing? I'm aware there will soon be staff games. The practice is for the staff game. Ask for staff and will be looking for us. Where are we? We are not available. Are we doing it? We need to look at that. Not only that, I'm aware that we have colleagues, we have senior members who has bias in specific sports. Prof. Chair, how I wish that as a university, we can look at those ones that are biased in specific sport and make them what? Honorary coach. You are honorary coach in basketball. You are honorary coach in athletics. You are honorary coach in football. You are honorary coach. Each of these sports, this tennis, you are honorary coach. You are doing that. What you are doing is to keep all of us together, active. Then we also look at being active as a person. Did you move from one place to the other? We'll get there, we'll look at what you need to do. All this, and there's one word that we keep using, physical fitness. What is physical fitness? Physical fitness has to do with you, after doing your normal work, how many hours? 8 to 5. For those that are so religious with 8 to 5. Some will have it from 7 a.m. in the morning and to 12 a.m. in the night. 8 to 5. When you are done with all those things, you are expected to have reserved energy for recreation and emergency situation. If you don't have that, you are not physically fit. Sorry, I'm not saying all of us are not physically fit. But if you look at yourself that after your daily work, you don't have a reserved energy for recreation, you don't have reserved energy for emergency situation, then you are not physically fit. Then, what of our movement with our family? How many times did you have daddy and mommy, family, let's go for road work. Let's go and do this. Let's do it together. Let's have a band. It is not there. Are we doing enough? You look at it. In the school, most of the time, you see us taking our children from their room. I won't say from their house. From their room, we take them straight to their school. And we pick them from the school. We pick them to home. There is no transport movement. These are some things. No active transport. Everybody is sedentary life. Are we doing enough? This in Ghana, this is where we are. They don't know have the pictures very clear. Those are the left-hand side of what we have is a grade. We're expected to be grade A if you are doing enough. In each of the components, we're expected to be grade A if we are doing enough. Then, the only one that we have, which is the best for us there, is active play. And that is B+. Overall, our grade is D+, which indicates how far we are going. Then, what are we to do? Briefly, I think us brief what we need to do. There are many things we can do, but the first thing I look at this. In some country, yesterday, Bro VC said he has a bicycle that he knows where it is, but how much he's using it is he was unable to tell us. Yes, bicycle. We are expected to embrace this. We are expected to embrace this. Can we have a situation where we declare a day in a month and say it is bicycle day? Or you walk to school. You walk within campus. And at the end of the day, when we do this one, we have, yes, we're going to enjoy ourselves for that day. Let's start from once in a month and do it. Then apart from, there are some countries, they don't use vehicle the way we use it here. They are fully, you know them, they are fully into bike. We should take example from that. Not only in terms of bike, let's look at fitting walk during your lunch. Fitting a workout during your lunch break. We have a lunch break that is in the system, but how we are implementing it, only God knows. We need to make sure that we make our lunch break, make it a workout section. Not only that, we need to strengthen our muscles where we are seated. Advise us at this point in time, can we please stand up? Let's stand up. Let's stand up. Let's stand up. How many, we know, we have seen it before. Stability ball. Some of us will call it medicine ball. You have a, I will show it when we get there. At this stage, it is better if we encourage you to please step out where you are, you will do it better. But instead of stepping out, can I please advise, if you, let's walk up and down. Let's walk up and down. Make sure you up there and come down. Yes, I will stop my presentation while you are walking, because it's part of things we are expected to do. Walk, make sure you get up there before you come down. Make sure you get up there. Just discipline yourself. Don't mind the man. Just discipline yourself. Walk up, down, walk up there, and you come. That's good. When you do that, there's one thing I want us to see, and that is the example we have there. Please, ladies and gentlemen, can we try to convert all our meetings to walk and talk meeting? Can we convert all our meeting to walk and talk meeting? I'm expecting you to go back to your seat. Go back to your seat. Go back to your seat. So can we do it? It is better for us to have what? Walk and talk meeting instead of sitting and sitting. That will help us walk and talk meeting. Apart from that, it is better for us to take the staircase. It will be good for us to take the staircase. It's also good for us to avoid stiffness. It is good for us to walk as much as possible as we will do today. One other thing that we didn't take note of, which we are embracing now, is our indigenous activities. And the first one I'll mention here is AMPI. We have conducted studies in the department on AMPI, and we have seen the effect, the positive effect of AMPI across all physiological parameters. We have seen the effect of AMPI on psychological conditions. And I want to tell us this afternoon that on no account do you engage in AMPI with others, that stress will not reduce. We will call it, is it not AMPI? It is AMPI. We are not celebrating it because it's our own. We live and we sleep with it. It's our own. We are not celebrating it. But I'm aware that though it is religious, you see people go into yoga. It started from a place. Why are we not taking our own AMPI? We have moved on and we are working towards it. Then your dog walk is another thing. You have your pet at home. The dog is there. The dog is waiting for you to walk. Let's go around. He will be happy. We want to celebrate with you. We want to enjoy being with you. You have to do that. Your gardening, let's take cognizance of that. Then have small weight and have some things you can work with in your office. Use the space there. You have many things. We'll look at it briefly, just as we don't want to waste so much of our time. Join the fitness club. We have the wellness center. We have everything there. Organize, monitor. But the last I want to talk about here has to do with our wearable devices. I expect us to monitor our health. It is expected that we should take nothing less than 8,000 steps per day. It is expected that we should take nothing less than 8,000 meters, 8,000 steps per day. How many of us are doing that? Get a wearable devices. Thank you for those raising of your hand. I really appreciate. Take your wearable devices. Don't use it as a fashion. Don't use it as fashion. I check mine. Sometimes I look at it. It's not as much as expected now. I have 6,008 already. You should be able to monitor your step every day instead of sitting for long. Then you can take a nap. You can practice good posture. The way we sit in our offices, we should also deliberately understand that there is a proper way. Allow your legs to be fully on the floor and allow the lower back to rest. It's expected for us to do that. Then I want us to use adjustable table. When I say adjustable table, we should have this one. We should be able to stand in your office, adjust your table, and do what you want to do. Adjust your table and do what you want to do. Ladies and gentlemen, I want us to start a simple exercise where we are, and that's because we used to write. It was an activity. You have a table before you. Can you please adjust your table? Adjust your table. Can you please adjust your table? Adjust it, adjust it. As if you want to write. As if you want to write. Put your two elbows on it. When we are very stressed up, this is good for us to do that. Put your two elbows on it. Can you please open your pen? Open your palm. Yes. Please bring it close to your face. Use it to cover your face. Use it to cover your face. At that point in time, please close your eyes and please don't think of anything. Close your eyes and hold on. Determine where you are. You don't know you at that point in time. Close your eyes and feel it for a few minutes. I don't want to give you time here. I will expect you to just think. Don't think about it. Just close it. After 2 minutes, you determine. After 3 minutes, you determine. Then we can put our hands down. Ladies and gentlemen, let's put our hands down. You are going to feel a sense of relief by doing that. It's your office. Your table is there with you. Your table is there with you. Do it. Then not only that, there's some movement you want to do. Can you please close your fist? Let's close our fist. Let's close our fist. It's your office. And that, you don't need a space. Close it, the two, and open it up. Close it and open it up. Close it and open it up. You can do as many as possible. It is to allow movement. After that, then allow the elbow to move there. It's in your position. Allow the elbow to move. It is in your office. You don't need to go to hospital to do this. In your office, you do that. By the time you are done with your elbow, please move to your shoulder. You move it. It's in your office. You do that in your office. Then, ladies and gentlemen, these are things you need to do where you are. Now, can we please, let's close the table. Let's return the table. Return the table. I know there is no enough space where we are, but in that position, we can try as much as possible to extend. Just try to see if you want to touch the ground. Your left hand, use your right hand to touch the ground there. Just try to see you want to touch the ground to the other side of you, from the right to your left. From your right to your left. Try it. Yes, while you are there, you move it to the right, you move it to your left. It's your position. And by doing that, you are better off. By doing that, you are better off. And that's good for us. And when we have some of us that probably God is so blessed with, I don't want to say we have the stomach. Yes, they are male, but you can see the circumference, if you compare it with 9 months, it's very close to it. Yes, that you can do it. You can use your chair. Just go down and fold your arms. When you fold your arms, allow yourself to tuck in the stomach a bit in your office. Probably you have a mat there. You can do it. And probably you're at home, you can do it, fold it, and it will help all of us. You can, this is an example, these are stability balls. There are many activities you can do on these stability balls. But this is what I want to ask us to do. Look at this activity. And you have your table in your office. Can you please stand up and just extend? It's in your office. Do it. Use your office. By the time nobody is with you, you are making yourself better off. You are making yourself better off. Then you can also enjoy yourself to do this. You can also enjoy yourself to do this in your office. We call it the chair dip. You can enjoy yourself. It's in your office. You don't need a separate chair. It's your office. Use your chair to be better off. We can do it. We can do it. Not only that, we can do this in our office. I can see some people doing that. Yes, you do this, you can do it. High heels in your office, do it there. And not only that, you can do a lunch in your office. It's your office. It's a determination. It's your office. You can do it, use a space there and do it. This is the last but not the least. I know we can do at home. We're going to do a bit of this when we get down there. We're going to do a bit of this when we get down there. Ladies and gentlemen, I have this sentence. I want us to fill in the gap. As we go, we'll soon be done. I want us to fill the gap. The gap there is a space. The yellow, is it yellow color? Is it orange color? Yes. Let's fill the gap. Your dash. What can we put there? Do we agree? Okay. We put health there. Then is your wealth and your... Let me help. After 10 years, 20 years of meritorious service, 30 years, 60 years, what do you want to ask for? What do you want to ask for? Somebody said life, yes. What else do you want to ask for? Happiness, that's good. Prof. Chair, permit me to say that what we need to ask for is, what is my gain? What is my gain? Listen, university here, you come here and one day, either you like it or not, you joyfully exit. The question is, what's your gain? Therefore, your health is your wealth. And your gain as an actively diligent individual. Ladies and gentlemen, thanks for listening.
Thank you very much. Please, a round of applause for our speaker, Professor Moses. We can only anticipate what we are going to do in the next 30 minutes when we move outside. Please, shall we welcome Professor Yawedu Sarkozy to make a presentation.
Professor, thank you very much. We look forward to the next 2 minutes that you take us outside for the exercise. We are grateful.